Hello, my name's Jo. I'm from the LEEP team, which is one of the pulmonary rehabilitation teams within Bristol. Welcome to this session. So what I'm hoping to do is introduce you to the concept of pulmonary rehabilitation. So what I'm hoping to cover in this session is to outline and help you to understand what it is that you've been referred to give you some information about the course so that hopefully you can make the right decision as to whether this is the right thing for you. To tell you how other people have benefited from attending the programme, and hopefully to motivate you to want to change and to do something different to help your condition and to get a commitment to the programme. So what is it that you've been referred to? So your healthcare professional, your GP, your practice nurse has referred you to pulmonary rehabilitation. So during this current period of COVID-19, this is a home-based exercise and education programme for people with chronic lung conditions termed as pulmonary rehabilitation. So rehabilitation for your lungs. It is a treatment for chronic lung conditions. It combines physical exercise sessions with education and information on health benefits on your lungs. And it's designed to help you manage the symptoms of your condition so that you can live better with it. So why have you been referred? The main reason is your breathlessness. So this is the main reason. So you are limited in your activities by breathlessness. Be it doing your shopping, be it walking your dog, popping your shoes and socks on, or your day-to-day chores. You are limited because of your breathlessness, and that is why you've been referred. So this is what we call the vicious cycle of inactivity, or the cycle of inactivity. So you do a task which makes you feel breathless. So this may be something as simple as walking to the shop to pick up your paper. It may be dancing, you're walking your dog. You feel breathless when doing this activity, which makes you feel fearful or anxious as to why it is that you feel breathless when you're doing it. And the body's very clever. With symptoms that we don't like, we try to find ways in which to adapt to avoid those symptoms. And that may be in avoiding the task that makes you breathless, or it may be that you simply slow down in doing those tasks. So you walk slower, or you take more stops along the way if you're walking. So over the period of time, we do less activity. Things take us longer to achieve. But those muscles become weaker. We don't use them as efficiently, and those weaker muscles are less efficient. They need more oxygen to supply those muscles for doing those activities. And so we start this cycle of inactivity. So a simple walk to the shop now becomes a walk that's twice as long with several stops, and over time that becomes even more of a chore, so maybe then you avoid doing it. So if you would turn this cycle on its head, what you would see is a spiral down. But actually what pulmonary rehabilitation can do is reverse that cycle. So what we would aim to do is to get you doing more activity. We want you to stop avoiding the activities that make you breathless by teaching you that breathlessness is part and parcel of physical activity, and that not all breathlessness is harmful, and it's not all attributed to your lung condition. We want these muscles to become stronger to enable you to do more. Stronger muscles are more efficient muscles, and they use less oxygen. So what do we aim to do? So we want to help you live better with your breathing problem, help you to cope with your breathlessness. And some of that is in understanding and education. So if you can understand what it is that's going wrong, why it is that you have the symptoms that you do, part of that helps you with the confidence in managing. We want to make you fitter and stronger. We want to help reduce anxiety and depression. So we'll talk in a little bit about the mind and the body works together. We want to be able to provide you support from a panel of people that are used to dealing with people with chronic lung conditions. So we have some experience and some expertise, and we can hopefully share it among individuals that are on the programme together, and hopefully overall improve your quality of life. So how will we help you achieve this? So we're going to provide you with the information to help understand your condition and your symptoms. and give you the tools to be able to manage it more effectively and regain control. We want to introduce good habits and good behaviours and give you self-management techniques for now and in the future. So living with a lung condition can affect you in 3 different ways: physically, emotionally and socially. So this would generally be the part at which I ask you to now think about: how does living with a lung condition affect you physically? And most people would generally say, I can't do as much, or I can't do my housework, or I can't walk the dog, I can't climb a flight of stairs. So how does that make you feel? Frustrated? Angry? Emotional? And what we often find is that with the physical and the emotional becomes this limitation in social. So people don't go out as much because it's just hard work. Or they have a cough and it's embarrassing, so they avoid things like theatres or cinemas. So it can really restrict what you do socially. So what is involved? Exercise. So nobody can get fitter and stronger without exercising, and that's no different to whether you live with a lung condition or not. So exercise is the core component of any pulmonary rehabilitation programme. So we need to strengthen your muscles and improve your overall fitness. And this combines strength training and exercises to work the heart and the lungs over either longer periods or short, intense bursts. Hand in hand with that comes education. So informative sessions covering aspects of your condition to help you manage and live better, to understand. So examples of these include assessment and diagnosis. So how is it that we've come to the diagnosis of asthma or COPD? What do the tests mean for you? And what does this diagnosis mean? What's wrong with your lungs? Breathlessness, that's a predominant symptom as to why you've been referred. So how can you manage your breathlessness better? Eating for health, that's incredibly important. So having a little look at somebody's diet and what it is that they're putting into their body. Self-management, you have to live with this lung condition. You have to manage your symptoms. So what we want to do is to give you a toolbox to be able to manage that, not just when you're not feeling as well, but also in better days as well. Look at what medications that you're on and why. Why are you taking the inhalers that you take or the medications that you're prescribed? And do you take them as prescribed? How to clear your chest. So we acknowledge that not everybody at every point during their condition may be productive, but it may well be when you're not as well or you have a chest infection or a pneumonia that you do. And chest clearance and lung hygiene is really important. How to manage symptoms other than breathlessness, such as cough. And also look around different therapies, so things like oxygen therapy, if that's relevant to you. So what is it? Pulmonary rehabilitation is a 6-week programme of exercise and education. And this is all done via an online learning platform. They are individually tailored educational videos which are specific to your lung condition. They are preloaded and they are guided exercise sessions which allow you to work through at your own pace, with specialist support from us in the pulmonary rehabilitation teams. We offer face-to-face virtual assessments, and they are twice weekly telephone reviews to ensure that you're keeping on track, that you're managing, and to address any issues that you may well have along the way. And any resources that are required for the course we will provide. But there are expectations. There are expectations as us, as providers, and there are expectations as you, as the individual on the programme. There's a requirement to have access to the email, website and internet. A commitment to work towards the recommended 150 minutes of activity a week. And this will be worked on towards over the 6 weeks that you're on the programme. We want you to develop a routine of activity. An expectation to watch the educational videos provided for you at each stage of the course. and to complete your home exercise record and walking diary to identify progression and perhaps where help is needed. So what happens next? So if you think, yes, this course is great, this is something that I think will really help me, and it's something that you want to engage with, a member of the team will contact you to discuss whether you would like to participate. We will ask your permission to check your GP records and any hospital records for any relevant information and risk assessment. You will be asked about your lung condition and the specifics of it and how it affects you, and in particular functional day-to-day tasks, the things that you find difficult. These are the areas that we want to address. We will ask you to fill in some questionnaires about your breathlessness, what you understand about your condition, how your symptoms affect your mood, and how much you know about your condition. You will also do a functional-based activity test. This will be done both at the start and at completion of the programme. You will then start as soon as spaces become available on the course. So questions. So I don't get breathless, or I don't have a lung condition. So this will be something that we will review once you are referred. And it may well be that you need to have a discussion with the person that has referred you. So if you don't get breathless, or you don't perceive that you have a lung condition, then this may not be the programme for you. My breathing is not the thing that stops me. And again, we have many individuals who live not only with a chronic lung condition, but other pathologies as well. So chronic pain, diabetes, high blood pressure, epilepsy. But predominantly we need to be able to get you breathless to be able to see improvements. So if it is pain, for example, from your hip or your knee that is your limiting factor, it may well be that pulmonary rehabilitation is not right for you at this time. I have other medical problems, can I still exercise? During your assessment and our risk assessment, hopefully we will identify some of these other medical problems and we will have this discussion with you. There are certain conditions that would preclude you from participating in the pulmonary rehab programme, but this would be a joint discussion with you. Very rarely does an individual live with just a lung condition, and they often live with other health problems as well. And exercise and activity can be very beneficial for many things, but this will be done on a one-to-one basis. I can only complete one session a week, is that okay? As I outlined on the previous slide, there is a commitment or an expectation that over the 6 weeks programme there will be a gradual and an increase to 150 minutes of exercise per week. Exercising once a week will not provide you with the benefits required from the course. I have difficulty moving or with my joints, can I still exercise? Yes, you can, but some of this ties back into the question about it being the breathing that's affecting you. If it is limiting you in that we cannot get you breathless when you're doing your exercises, then it may well be again that pulmonary rehabilitation is not right for you at this time. But hopefully we are all physiotherapists that will be doing the assessments. These will be discussions that we would have with you on a one-to-one basis. And what if I have a chest infection? The evidence tells us the sooner that you can start to exercise following a chest infection, the better your health outcomes. We preserve your muscle function and your respiratory capacity, so we would definitely recommend that following a chest infection, as soon as you are starting to feel better, that we would like you to engage in gradual in exercise. So it certainly wouldn't prevent you from participating. So in summary, pulmonary rehabilitation is a treatment for individuals living with a chronic lung condition, where you're affected by your breathlessness on a day-to-day basis. So if you have been referred to our service, a member of the team will contact you shortly to discuss whether this is something that you would like to move forward with. Alternatively, you can make contact with us, the team, on 0117 414 2010, or drop us an email on leapinfo@nbt.nhs.uk and we will get back to you. Thank you.